Hello and welcome to today's Here's to Your Health podcast. I'm your host, Don Lintzman, and we're on the podcast today with the HIM staff here at CCMH because this week is HIM week. And we're going to have everybody introduce themselves real quick before we get into the meat of our podcast. We're going to talk about coding today and why that's really important in our healthcare experience. So let's start with Carmen.
My name is Carmen Schuett. I've worked at CCMH for almost 11 years and done coding for 10. I am also the new service director for Arthur EMS, and I drive ambulance for Odebolt.
My name is Ana Garcia. I've been with CCMH since July of 2021. I've been coding for 14 years, and I really do enjoy it.
Hi, my name's Laura Gross. Prior to coding, I had 10 years experience as a surgical technologist, so the transition to coding was helped by that career. I've been coding for about 7 years.
Hi, I'm Dixie Janssen. I've been at CCMH since 2002. I've been coding for 8 years now, and I started prior to coding. I was a transcriptionist.
I'm Tracy Kastner, and I've been with CCMH for 21 years in July, and I have been coding for over 32 years.
Oh my gosh, I haven't been doing anything for more than 32 years except being married. Wow, 32 years, that's a long time to do any one thing. You know, part of what people don't get is that they tend to think that the entire healthcare experience is spent with a doctor or a nurse. But the reality is that it's a lot more complicated than that because no one gets paid unless the coding gets done. So probably what we need to do is start by just defining what health information management or what medical coding actually is. And I think you're going to help me with that, right, Laura?
I am. Well, medical coders, we translate the details from a patient's medical documents, such as a physician's note, lab reports, procedures, diagnoses, into universal medical codes. And then we maintain accurate medical records. The healthcare providers and insurance companies use these standardized codes for billing and record keeping.
And people wonder sometimes why it takes so long for them to get their bill. Well, there's a perfectly good reason for that because it just takes time to do all those kinds of things. You know, there's some education and certification that has to go on, though, to become a medical coder. Tracy, you've been doing this for 32 years. I think you're probably the best person to answer that question. When it comes to education and training, what does it really boil down to?
You do need to complete some type of a degree or certification program, which does include medical terminology, anatomy, and some physiology and pharmacology, and also pass a proctored test. After the proctored test, once you get your certification, you will need to keep up your continuing education hours every year, which are easy to find to keep those up. So, yeah.
You know, the one thing about medical coding is that it's there's a lot to it. We're going to talk about it in just a second, but there's a lot to this, and even after 32 years, I've got to believe that perhaps you have seen it all, but maybe not because things change.
I have seen a lot of changes and a lot of guideline changes, and that's where you need to keep up your continuing education so you keep up on the ever-changing guidelines.
Yeah, things in healthcare change dramatically and change all the time. Our podcast today, our guests are our HIM staff here at CCMH, our coders, and we're talking a little bit about medical coding and what that is and how it works. Ana, while coding sounds complicated, it gets even more complicated when you talk about what some of the elements are.
There are 3 types of universally known medical alphanumeric codes: the International Classification of Disease, or ICD. The World Health Organization, WHO, created this internationally used code. The classification system is largely used for the purpose of health recording and data collection, among other uses. These codes can classify symptoms, disease, illnesses, and cause of death.
And you know, one thing I do know is that the ICD codes change. because they changed here a while back in response to Obamacare. We went from ICD, whatever that was, whatever version that was, like 7 or 8 or 9 or whatever. Now we're on ICD-10, and the number of codes went from in the hundreds to the thousands. And I know that there's going to be another iteration of this coming in the near future, and it's going to be ICD-11, which means it can only be more complicated. But there are other codes that we have to talk about as well.
Correct. Current procedure terminology, or also known as CPT. CPT codes identify medical, surgical, and diagnostic procedures and services within the U.S. The American Medical Association, or the AMA, developed this system, which includes 3 categories: procedures and contemporary medical practice, clinical labs, and emerging technologies. Healthcare Common Procedure Coding, or HCPCS, the Centers for Medicare and Medicaid Services, CMS, developed this coding system to help with processing insurance claims for Medicare or other providers. Coders use them to note medical procedures, products, supplies, and services.
You know, up until this very moment, I had not heard much about HCPCS, but you've piqued my curiosity, so I'll need to learn more about HCPCS, because that sounds like fun. Not maybe quite so much. Coding probably, though, is the best kept secret. I mean, part of what happens is that because we're dealing with very sensitive medical information, patient information, our HIM staff is behind locked doors so that people do not have access to any of the information that you're dealing with. So, you know, if you want your claims paid, this is one of the most important jobs in the hospital or clinic, even though we can't see the coders. Right, Dixie?
Yes, that's right. Medical coding's primary use is to ensure medical billing and insurance carriers pay and process claims correctly. But the system is also valuable for research purposes and basic medical record keeping for patients. Each code tells an insurance company's researchers and healthcare providers the exact diagnosis, procedure, and or the medical service provided. In short, these codes act as a universal way to quantify healthcare visits and make physicians' notes less abstract from insurance carriers and future health providers.
Yeah, the specificity of a lot of the codes is really what they're after, so that they're obviously data collection, but they want to make sure they're paying on the correct procedure. But before anybody gets the idea that this is more of a science than an art, we have to talk about the core responsibilities of a coder. And Tracy, maybe you can share that with us.
So one of the most important responsibilities of a medical coder is to ensure the accuracy of the medical records you transcribe and the codes that you use. Some of the other medical code job requirements include proficiency in a variety of medical codes and adherence to the medical coding code of ethics. And some of the day-to-day responsibilities that we have here at the hospital, we transcribe patient information into appropriate medical codes. We also examine medical documents and records for missing information, conduct chart audits. We collect research and filing patient medical information. We're always ensuring all documents are grammatically correct. And we also have to comply with medical coding guidelines and policies.
I think probably one of the more complicated things that you have to deal with is the fact that it's not just getting information and then putting it into a form and assigning it a code.
Correct.
But it is actually having to go back through patient records to make sure that everything is noted and coded appropriately.
Right.
Because otherwise, nobody gets paid.
Exactly.
Correct?
That's correct.
Which I think is what we're all after. So I think your job is much more complicated than a lot of people would normally imagine that it is, but it's also why you need the certifications, passing a proctoring test in order to be able to do the job properly all the time, every day. The podcast today, the Here's to Your Health podcast, I'm your host, Don Lintzman, and you're listening to our HIM staff talk about billing and coding, because this is National HIM Week, and we want to make sure that we recognize the people who are doing all the important work here at the hospital. As opposed to the marketing guy, we want to hear from the people who do the real work, which is what I think is really important. On a last question, people may confuse coding with billing. Those are two separate things. So what are the biggest differences between a medical coder and a medical biller?
So medical coding differs from medical billing in that medical billing deals with financial transactions between insurance carriers and healthcare providers. A medical biller is in charge of processing insurance claims, generating bills, and managing balances and payments for healthcare providers. Medical coding, on the other hand, only pulls billing information and details from the patient's record to translate into medical coding. So while both professions deal with medical records, they are in fact entirely different jobs.
That is a very succinct explanation, and I think that that's the best way to end up today. I want to thank all of you ladies for joining me and being willing to come on the podcast, because not everybody is willing to do that. You did an excellent job. It's great. I realize you don't do it every day, but that makes it even better because it sounds very authentic, and you're telling us stuff that even I didn't know. So I appreciate it very much. My guests on the podcast today are HIM coding staff here at CCMH. We're talking about coding because that's a really important part of our medical process. It's how people get billed, but it's also how people get paid, and it's one of the most important things that we do on a daily basis. I want to thank you for listening to the Here's to Your Health podcast. I'm your host, Don Lintzman. Have a great day.